A cardiac emergency can happen anywhere, at any time, with a sudden physical distress that strikes without warning. While we often picture a dramatic clutch of the chest, symptoms vary widely between individuals. Unexplained sudden fatigue, severe bouts of nausea, or a spreading ache to the jaw and shoulders are all common warning signs, especially for women and older adults. In the next few minutes, we are going to build a clear, step-by-step mental framework. You will learn exactly what to do to manage a cardiac emergency before professional help arrives. When you know the protocol, you can replace panic with immediate, informed action. In an emergency, that action is the difference between a tragedy and a saved life. Step 1 is recognizing the warning signs and taking action immediately. Never wait to see if the symptoms disappear on their own. Your first move is to call emergency services. If you are in the UAE, dial 998. Put your phone on speaker so your hands are free and you can listen closely to the dispatcher's instructions. Keep the person sitting down, resting comfortably and completely calm. Any unnecessary movement forces the heart to work harder, so keep them stationary. If the person is an alert adult, has no aspirin allergies, and hasn't been told to avoid it, they can chew and swallow between 162 and 325 milligrams of aspirin. This is a temporary measure to help thin the blood, not a cure. Under no circumstances should you allow the patient to drive themselves to the hospital. By keeping the person stationary and calling an ambulance, emergency medical care can begin the moment paramedics arrive and continue en route to the hospital, greatly reducing the risk of sudden deterioration. To respond correctly, you must understand the difference between a heart attack and a sudden cardiac arrest. During a heart attack, a plumbing issue, blood flow to the heart muscle is severely blocked, causing damage. Sometimes this blockage triggers systemic failure. The electrical pathways fail, and the heart stops pumping entirely. This is cardiac arrest. You will know this transition has occurred if the patient suddenly collapses and becomes completely unresponsive to your voice or touch. Immediately check their chest for normal breathing. Occasional irregular gasping is not normal breathing. If they are only gasping, treat the situation as a full cardiac arrest. When an unresponsive patient stops breathing normally, the problem has escalated to a complete electrical failure. This demands your immediate, direct manual intervention. Do not waste time searching for a pulse. For an unconscious, non-breathing adult, immediately begin hands-only CPR. Place the heel of one hand directly in the center of the chest. Put your second hand on top and interlock your fingers. Position your shoulders directly over your hands and keep your arms completely straight. You will use your upper body weight to push down, not your arm muscles. Push hard, compressing the chest at least 5 centimeters deep. You need a strict, rapid pace of 100 to 120 compressions every single minute. Between every downward push, lift your weight enough to allow the chest to fully recoil back to its normal position. This allows the heart to refill with blood before your next compression. Your rigorous, continuous chest compressions act as an artificial pump. You are mechanically forcing oxygenated blood to the brain, preventing irreversible damage while you wait for professional help. If another bystander is present, instruct them to find an automated external defibrillator, or AED, and bring it to you while you maintain uninterrupted chest compressions. The moment the device arrives, turn it on and strictly follow its voice instructions. The machine will tell you to expose the patient's bare chest and attach the adhesive pads exactly as shown on the pictures. Once the pads are on, step completely clear of the patient. The AED will automatically analyze the heart's rhythm. If it determines a shock is needed, it will instruct you to deliver one. Once the shock is delivered, or if no shock is advised, immediately resume CPR. CPR buys time by manually moving blood, but an AED is the only tool capable of resetting a failing electrical system. Combined, they form the ultimate survival mechanism for sudden cardiac arrest. Before we review, there are critical mistakes you must avoid. Never try dangerous, unproven methods like cough CPR. Do not attempt home remedies, and never put food or water into the mouth of an unconscious person. There is also one strict exception to our protocol. If an unresponsive patient is breathing normally, CPR is not indicated. Simply monitor their breathing and wait for emergency services to arrive. Continue your efforts until the person begins breathing normally and moving, or until emergency medical professionals take over the physical toll of resuscitation. This checklist outlines the exact protocol to remember. Identify the medical emergency and alert first responders immediately. Begin manual chest compressions if they become unresponsive and stop breathing normally, and apply a defibrillator the moment one is available. This video is for educational purposes and does not replace formal CPR certification. In a real emergency, call your local medical services and follow the live dispatcher's instructions word for word. You do not need a medical degree to act. By stepping forward in those critical first minutes, you hold the power to sustain a life while help is on the way. Learn CPR. Know where the AED is. Be ready.